Hi everyone, today we're doing a quick tutorial on our new CDM patient identifier tool. This new tool screens your patient database to identify high potential patients for your CDM program that look like they haven't currently been registered. This can save the practice a huge amount of time in screening patients for the CDM program and also generally results in higher registration numbers overall. So what are the criteria that we use to identify the patients? Well, firstly, medical coding. If the patient has any ICD-10 or ICP-C2 coding that might indicate they have a chronic disease, they're obviously flagged. Even if the patient doesn't have medical coding associated with a file, we do have other criteria. So we screen the patients based on prescription. So if the patient has a prescription history with a drug that has an ATC code that's associated with certain chronic diseases, we'll flag that. Consultation note terminology. We also have our own proprietary system that screens terminology within consultation notes to identify key terms that are associated with certain chronic diseases. And finally, we have our lab investigations. This is only applicable to some of the chronic diseases, like diabetes, where we screen patient results like elevated HbA1c readings to identify the patients. Based on these criteria, we've identified 284 high potential patients and 899 possible patients. High potential means that they've met either the medical coding criteria or lab investigation criteria, as these are the highest threshold. Possible patients are those that haven't met these higher criteria or more accurate criteria, but have met the prescription drug or consultation note criteria. We recommend most practices focus on high potential patients to begin with, screen those patients, get them registered, and then once that's complete, work on the possible patients. If you want, we do have a patient category here, so you can easily select high potential patients only, apply filter, and this will reduce the list significantly to only those high potential patients to begin with. If we take a case example, in most practices, a member of the clinical staff will review the list, mark the patient to be registered, or reject the patient if they feel they aren't suitable to be registered for the chronic disease program. In this case, the clinician is going to look for patients with diabetes that have met the medical coding criteria. So yes means that they've met the criteria, no means that they have not met the criteria. Both means that it will screen for both patients to have a yes or a no. In this case, we want those that have met the medical coding criteria. We'll also screen yes for the lab investigations so that we get those patients with elevated HbA1c readings. We'll adjust the age criteria to those below 100 and let's say above 40. Apply filters, and this should make the numbers much more manageable. So the idea being that the clinician will then work through this list, mark the card to register for patients that they wish to be registered to the CDM program. That automatically updates. Then the next case, they feel maybe that the patient isn't suitable, they can easily reject them. Where do these cases go once they've been marked? Very simply put, they go to these other patient listings. So we have a full list of all the patients here. So we just select to register, apply filter. This will show all the patients that have been marked to register for the CDM program. The idea being generally that a member of the admin staff will then come and review this list, look to get all these patients registered within your practice management system, and that will also automatically reflect here. So as soon as that admin member registered them within your practice management system, that will update nightly to MedVault and they will be automatically removed from this list. So that's pretty simple. That's how the system works. It certainly helps in screening the patients very efficiently. And yeah, if you have any questions or suggestions, please feel free to contact us. Use the chat button in the bottom right hand corner. Send us a message and we'll get back to you as soon as possible. Thank you.